Morning, Central New York. Dr. Joe Borio reaching out to you this morning. Hopefully you guys are starting your day off with a great day. I like to start my day off with some reading, a little exercise, a little coffee, you know what I mean? Get fired up. I like to get to the office early when no one's here. It's one of my favorite times to come into the office because I just, I get a lot done and get my head in a good place. And I also like to spend some time getting in a really good place to take care of people, because we take care of a lot of people throughout the day, and hopefully you're one of them, or you're going to be one of them. And when you come in, I want to be at my best, certainly, so I can serve you at your best, right? So I want to talk today about medical doctors. I had a couple of patients in yesterday, and they came in and they've been getting care, and they're doing really well. They're like, wow, geez, Dr. Borio, I'm doing so much better, and you've made a huge impact. Getting care in this office made a huge impact in my life, in my health, and I just want to ask you something. I said, what's up? And they said, well, I talked to my medical doctor about coming in a while ago, and they just gave me some pushback on it. They didn't really have anything positive. They were always trying to send me out for therapy. They were trying to send me out for medication. They were trying to send me out for different injections and blocks, and I just didn't seem to get a positive push. So I decided, I'm just going to come on my own. I'm not going to rely on their advice to take care of myself. And it's such a great question, isn't it? Because you wonder, like, wait a minute, we're all in healthcare, and we all want to put the interest of the people we take care of, you, ahead of our own worries or our own issues or our own personal views or whatever. And you're like, well, wait, I'm the patient. What's best for me? So there's a few really answers to that question. One of them lies in our education. When I go to chiropractic school, we aren't taking studies and research on how to do spinal surgery. I'm not taking courses on how to take your appendix out, right? In fact, I'm not taking a lot of courses on medical treatment because I'm a chiropractor. So chiropractors are looking at the body almost an entirely different way, in many ways. And then if I'm a medical doctor is going to primarily study a lot of different diseases, as they should, and they're going to come up with medical treatments, medical approaches to address some of these situations. And here's the problem that you run into. Chiropractors are out there primarily to take care of the body, almost like a carpenter, if you will, or the dentist, if you will, to take care of the body, to keep it functional, to tend after you, and to tend after your spine and nervous system in order to keep your body functioning well. Where medicine and really started off with really acute care, acute treatment. So what does that mean? That means that a medical doctor typically is looking at you and going, wow, what is going wrong, and do you need any invasive type of treatment? Where we get into the problem often is in those chronic situations where somebody comes in with chronic problems, right? And often we're in the medical approach is looking at it from, how do I treat you with chemistry, right? Drugs. What can I cut out of you in order to resolve the issue? Where a chiropractor job is irrespective and irregardless of any of that. So let me give you an example. Let's say you have, just using a contrast analogy, let's say you have a cavity in your tooth, right? Are you still going to brush your teeth? Like, you're not going to go, oh, I got a cavity, I got to do something different. You're still going to brush your teeth, right? Let's say you have a cavity in your tooth and you got migraines. Are you still going to brush your teeth? Let's say you don't have any cavity in your teeth and you have irritable bowel syndrome. Like, are you still going to brush your teeth? Like, essentially, one's got nothing to do with the other. And I think that's where the confusion comes from. So you've got a whole group of medical doctors out there that have an opinion or have been educated on what a chiropractor is or isn't. And unfortunately, almost everything they have been told and not educated on is wrong. A chiropractor, my job is not an alternative to medicine. So my job is not to take the place of your medical doctor. Never has been. My job is not in some way to prevent you from taking a drug or from taking surgery. That's not my job as a chiropractor. My job, much like a dentist, is to take care of the spine and the nervous system. Why? Because the nervous system, your brain, and everyone knows this, tells your body what to do, everything. So the brain needs to talk better through the body, through the spine, and through the nerves. So my job is to take it. So I think most of us would agree that if I took care of your spine and your nervous system works better, whether you're a child, whether you're an adult, whether you're a senior citizen, and I gave you a little bit of handout on how to eat a little bit better, and I got you to do a few little simple exercises, a couple of things to move better, I think most people would say, wow, I'm going to feel better. I'm going to be healthier. I'm less likely to what? Need drugs. I'm less likely to need surgery. And not only that, if I ever did get sick and I need drugs or surgery, won't I be a better patient? Wouldn't I be healthier? So the reason that most medical doctors are uneducated on chiropractic, I don't want to say they don't like, we see a lot of medical doctors as practice members, right? The reason that happens is they've got the wrong information. They didn't take a course. No one sat them down and said, hey, Dr. Johnson, this is what a chiropractor does. This is what we do. This is why we do it. This is what's important. This is what we take care of. It's not competition. I'm not in competition to a therapist. I'm not in competition to acupuncture. I'm not in competition to your medical doctor. I'm out here to take care of your spine and nervous system. So much like the dentist is out there to take care of your teeth so that they're healthy, and you may need a specialist within dentistry, right? You may need some medical attention on a tooth. The reality is the best way to take care of your teeth over everything by far is to brush and floss your teeth, right? So the best way to take care of your body mechanically is to what? Make sure that you're tending after your spine and nervous system. Make sure that your family is getting regular adjustments and regular care. One of the things that I often do is I reach out to a lot of people in the medical community to educate them. They're obviously very smart people, but to educate them on what it is I do and why what I do is necessary and a requirement for the body to work well. And in no way does it infringe upon what they do, because my goal isn't to infringe on what medicine does. My goal is to make sure that you tend after your spine and nervous system. When you're a baby, your spine is crooked. Right after birth, study after study has shown that. So your spine gets crooked. That immediately interferes with your brain's ability to talk to people. That's why we insist on checking children. That's going to cause colic issues. It's going to cause breathing issues. It's going to cause digestive issues. It can lead to children having more strep throat or double ear infections because the immune system's weakened. There's study after study that demonstrates that. So clearing those areas up allow the baby to be better. We also see children with learning disabilities, speech delay, ADD, ADHD, right? But think about this. Most people are never getting care when they're little. So now 10, 20, 30, 40 years goes by. You come walking in my office. Think about that neurologic damage that's been there since you've been 30 years ago, 40 years ago, right? As a child. So some of that is still there, if not all of it, right? Not only that, think about what's happening to the spine being crooked for 30 or 40 years. Now it starts to deteriorate. So people in their late 20s, 30s, they walk in and their spine's a wreck because nobody's been taking care of it. So now we're looking for drugs and injections and surgery, which unfortunately is necessary sometimes. But my job, regardless of whether you're getting that or not, my job is to make sure we tend after it. Point is, if I get one bad tooth, I wouldn't stop brushing the other 31 of them, right? I would get that one treated and I'd brush all 32 of them, right? So same idea. I got 24 vertebrae in my spine. If one or two go bad, I'm not going to not tend after the 22 or 23 of them. I still need to take care of the other 23 so that they don't end up like the one that got bad, if that makes sense, right? And that's why it's critical. That's why it's so necessary. That's why it's important. And unfortunately, many people in the medical community aren't educated that way. So what happens is you create this lack of communication between two people who are trying to take really good care of you. And we often look at it as one person's trying to treat the same thing that the other person's trying to treat. I'm not trying to treat the same thing. I'm basically there to take care of you. Irrespective if you got a health challenge or not, your spine always needs to be cared for. Just like irrespective if you got a cavity or not, you're always going to brush and floss your teeth, right? The value is actually higher when you're healthy than when they're sick. So maybe that clears it up, maybe it doesn't. Hey, listen, if you like what we're doing, and you like what I'm sharing with you guys, make sure you like the videos, make sure you share them. Share them to some groups in Central New York. I'm Dr. Joe Borio, chiropractor right here in Cicero, New York. Love to take care of you. We're ready to get going here and open the doors here in about a half hour. And I love it. It's one of my favorite parts of the day when we open the door. Just give you a look at the office so you know what it kind of looks like. So give us a call, hit the link in the description, brings you right to our website. You can actually set up an appointment, your first appointment right on the website. It's $37 to come in and get in a checkup with your x-rays, which is great. And I make it inexpensive because I don't want money to be a barrier for you or your family. And I don't want to make it to where it's cost prohibitive for you to come in and get taken care of and getting care. If you want to talk to me, if you want to reach out to me, just call the office. You can text us. You can give us the old school call us. You can email. However you want to get access to me, however you want to make an appointment, get in the office. Let's take care of you. Let's meet. Let's talk about how we can better serve you and your family to make you guys live a longer, stronger, healthier life for a lifetime. Love and appreciate you guys. Have a wonderful day. Make sure you do something special for somebody. Really important, probably best part of our videos. Make sure you do something special for somebody else. It's the best way to make you feel better. Talk to you guys tomorrow.